Warm good morning to all of you, and I really thank All India AIOC for giving me this opportunity to speak a few words on this is a very old procedure which is being done since ages, and I just wanted to share my experience of using platinum chloride and hydrogen hydrate for tattooing the corneal surface. No financial interests. So as we know, it is a very age-old practice of, covering the scarred cornea with black pigments in order to take care of the cosmetic disfigurement following the scarring. It was first introduced as early as 2000 years back by Gallen. So it is basically done to mask corneal opacities or any white reflexes in the eye in eyes with low or nil visual potential, and also in a seeing eye it can be done to reduce glare and visual disturbances associated with pupillary and iris defects. So with the advent of time, as the techniques and the surgical instruments have been developing with the advancement of technology, better and improved ways of covering the corneal surface with pigments have been devised. So commonly it can be done in cases of corneal scars or adherent leukomas, iris defects, in unpleasant strabismic diplopia and Urey-Zavalia syndrome. And stains used are mostly metallic stains like gold and platinum. Non-metallic stains like India ink and lamp blanc ink have also been used, and even organic dyes have been used for tattooing. Different procedures are available, like surface tattooing, stromal punctures, intrastromal lamellar dissections, and even femto laser-assisted tattooing surgery. So in my case, I am just doing it as a surface procedure. I select, we had 7 eyes of 7 patients within a period, via time period of 1 year. After a thorough examination, including a posterior segment ultrasound, and patients were mostly interested for cosmetic correction of their unsightly scar. So we had various categories of patients. Most of them had PL absent or doubtful PL. One of the patients, he was a case of previous multiple keratoplasties. Even I had done he was a case of complicated cataract surgery followed by scarred corneal decompensation and aphakia, and then I took him up for optical PK, and then later on he developed a graft infection, and then we had to again take him up for a therapeutic PK later on, and following secondary glaucoma and other complications of keratoplasty, he had finally a PL absent eye, and he was finally interested for cosmetic correction, and we took him up for this tattooing procedure. Another case, she was a young female with a history of corneal trauma in childhood, and she was left with a non-seeing eye with a white cornea. Most of the cases, as we can say, are mostly following trauma, for scarring following corneal trauma. One case had multiple VIA surgeries too, and he had this white reflex in the center. We had to take him up for a partial tattooing involving only the scarred area. So, and all of them were not, few of them were not interested for cosmetic contact lens use, and 2 of them had intolerance actually. So patients were nicely explained about the aim of doing the surgery, that it is only for cosmetic reasons and not for any kind of visual gain. We did the surgeries under topical anesthesia. The dyes, as we have already mentioned, it is 2% platinum chloride and 2% hydrogen hydrate. Unfortunately, I could not retrieve the video, so I've just written the steps here. That after a proper sterile procedure, protocol was maintained, the topical anesthesia was instilled, and the corneal epithelium was scraped. After drying the cornea with a sponge, we used 2% platinum chloride solution, which was soaked in filter paper and placed for 2 minutes. Following this, the 2% hydrogen hydrate solution was used, which was actually the reducing agent. After 30 seconds of use, we removed the filter paper and we waited for 1 or 2. It takes some time to the color takes time to get developed, and slowly the color changes. As we know, platinum chloride is a yellowish a powder. After we have to dilute it, make it a percentage of 2%, it becomes a yellowish solution, and upon reducing with hydrogen hydrate, it turns into blackish color. So after that, the surface is rinsed with lingalactate, and I place a BCL over the surface, and then in the next post-operative day, I usually put plain antibiotic drops for 4 times a day for 2 weeks, and then 1 drop of atropine at bedtime for 3 days to reduce the pain. Also, oral analgesic tablets are used for 2 days. And then after 48 hours or so, I usually remove the BCL after ensuring epithelial healing, and we start on topical steroid drops after we taper dose over 3 weeks. Patient satisfaction, we usually assess in front of a mirror, and then most of the patients had very good response in terms of satisfaction. None of the patients had any intraoperative or postoperative complication, and no additional staining. But these are some of the pictures which I had taken for the patients. As we can see, the post-operative picture, the cosmetic part has been taken care of. This is the patient with multiple keratoplasties, which undergone almost the center part was very much thinned out. It was not appropriate to go for an intrastromal or lamellar tattooing procedure. Sorry.
Please sum up.
Yeah. So we can just skip to this is the one with the partial tattooing. So as we can see, only problem is in case of a colored iris, like low light colored iris, it would be difficult to match the color, because this agent, platinum chloride and hydrogen hydrate, only gives us a black color. So some of the studies done previously showed some of the complications, like some needed a restaining, some had some kind of toxic effects like granulomatous keratitis or uveitis. So as we know that it of course gives a satisfactory result in terms of cosmesis in eye, absolute eyes, both, as well as in eyes with some degree of vision, but with problems like glare or due to iris defects or dilated pupil. So we can go for this technique in more. I mean, we can have this technique as a routine, as a regular procedure, because even the cost factor is not much high. So other than this corneal surface tattooing, we also have intrastromal and or lamellar techniques where we can use directly inject dye in the corneal stroma for getting the desired results. Thank you so much for your patient hearing.
Thank you.
Thank you, sir.
So how many days, what is the duration of a stay? Like once you do the tattooing, how many months it stays there?
So mostly we have followed up the case till up to now. We have been seeing them for up to 6 months. There has no fading or requirement of retattooing. They usually say up to 3-4 years the color is always as good as the it is acceptable, but maybe over a period of 8 to 10 years they may get faded up because it is a surface procedure. That's the thing.
So from where you procure all these dyes?
So this we procured from Chennai. There is a pharmaceutical company, Chandanmal. We directly talked to them and they provided us over by courier.
Okay. So is there any difference in doing this procedure on post-keratoplasty eye and in normal corneal scar eye?
Sorry, sir?
Is there any difference in doing procedure or outcome in doing the normal, like after trauma you get a scar and in failed keratoplasty cases you did?
No sir, not really, not really. If the corneal thickness, everything is, we just have to take care, there should be no, we have to take care of the perforation part. We should not go the scraping has to be really done gently on the areas of thinned out, so where suppose previous melt has happened. So those areas we have to be a little bit careful. Otherwise, it's same for both categories of corneas.